Good evening. This is All India Radio, Kohima. I'm Jonas Yandan with Evening News. The headlines. Today is International Nurses Day. Vice President Venkaiah Naidu and Prime Minister Narendra Modi expresses gratitude to the nurses for rendering selfless services to the people. Principal Director Health Department says state is expected to receive vaccines for 18 to 44 years within next 1 week. Health Department asks all beneficiaries due for second dose of vaccination to avail it at the earliest. And PM Cares fund a court sanction for procurement of 1.50 lakh units of Oxycare System developed by DRDO at a cost of over 322 crore rupees. As the number of COVID cases is on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Today is International Nurses Day. The day is observed every year on 12th of May to honour the nurses. It also marks the birth anniversary of Florence Nightingale, the founder of modern nursing. The theme for this year is Nurses, a Voice to Lead, a Vision for Future Healthcare. Vice President Venkaiah Naidu has complimented the nurses for rendering untiring and selfless service to the people. He said our nurses have been at the forefront during the pandemic, being a critical link in our health infrastructure. Naidu called upon people to express gratitude to them for their invaluable contribution in advancing the health and well-being of the people. Prime Minister Narendra Modi said International Nurses Day is a day to express gratitude to the hard-working nursing staff who are at the forefront of fighting COVID-19. He said their sense of duty, compassion and commitment towards a healthy India is exemplary. Information and Broadcasting Minister Prakash Javadekar has expressed deep gratitude and kudos to the spirit of all the nurses who are the primary caretaker, especially during these COVID-19 times. In a tweet on International Nurses Day, Javadekar said they are the ones who care and nurse people to recovery, sometimes like a mother, at times like an elder sister. On the occasion of International Nurses Day, Chief Minister Nipirio said nurses are an integral part of the healthcare system, and amid the COVID-19 pandemic, they continue to work tirelessly with dedication and perseverance. Rio said, we salute their contribution for the welfare of the society and commend their altruistic spirit. Health and Family Welfare Minister S. Pangyapom on the occasion saluted the nurses posted in all corners of our state and acknowledged their selfless service and acts, working continuously in their duty shifts, risking their own health and well-being, especially as we face the current pandemic. Pangyu also thanked and acknowledged their enormous contribution to the healthcare community, which has enabled the state to continue and keep up the fight against COVID-19. The Health Minister also said it is not only this day, but their tireless hard work and continued services deserve our gratitude every single day. Principal Director Health Department Dr. Nikrile Kimiao has said that the state is expected to receive vaccines to be administered to 18 to 44 years of age within the next 1 week. Dr. Nikrile, while interacting with some section of media personnel at his office today, said the order has been placed along with advance payment, and if things go favorably, within next 1 week or so, we should be able to have the vaccine in our hands. With the government announcing the statewide total lockdown from May 14 to 21, the Principal Director said further line of action will be decided after closely monitoring on the growth and improvement of the cases in this lockdown week or so. Nagaland Health Department has asked all beneficiaries due for second dose of vaccination to avail it at the earliest. In a press release, State Immunization Officer Dr. Ritu Tur said those beneficiaries' due time of 6 to 8 weeks is falling between the month of May. He also requested other beneficiaries to avail the due second dose as and when it comes. The State Immunization Officer further informed that COVID-19 vaccination will continue during the lockdown for all eligible citizens. The due beneficiaries for second dose are requested to carry their registered mobile phone and ID document used while getting their first dose for their vaccination to the police personnel, volunteers, so that they do not face unnecessary harassment while going for vaccination, Dr. Toor added. Meanwhile, a total of 32,770 beneficiaries are due to receive their second doses for this month. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. A total shutdown of power supply has been initiated in the whole of Wokha district, Upper Range, Zeminu and Bukoputo areas starting from tomorrow. In a press release, Executive Engineer Transmission Division Kohima informed that a shutdown of power supply is scheduled from 13th to 14th of May from 7 a.m. to 5 p.m. It said the shutdown has been necessitated for dismantling and de-stringing works of 132 kV tower on Kohima-Wokha-Doyang transmission line near Longsa village affected due to stone quarrying. Further, the affected area of the power supply will be the whole of Wokha district, Upper Range, Zeminu area and Bukoputo area, it added. All public in the affected areas are requested to extend cooperation and bear the inconvenience during the shutdown period. The PM CARES Fund has accorded sanction for procurement of 1.50 lakh units of Oxycare System developed by Defence Research and Development Organisation, DRDO, at a cost of over 322 crore rupees. Oxycare is a SpO2-based oxygen supply system which regulates the oxygen being administered to patients based on the sensed SpO2 levels. Under this sanction, 1 lakh manual and 50,000 automatic Oxycare systems, along with non-rebreather masks, are being procured. The Oxycare system delivers supplemental oxygen based on the SpO2 levels and prevents the person from sinking into a state of hypoxia, which can be fatal. This system was developed by Defence Bioengineering and Electromedical Laboratory, Bengaluru, of DRDO for soldiers posted at extreme high altitude areas. The system is indigenously developed for operation in field conditions and is robust. It can be effectively used to treat COVID-19 patients. The country has registered over 3,48,000 new COVID cases in the last 24 hours. The Health Ministry has said a total of 4,205 deaths have been reported in the country within 24 hours, taking the toll to over 2,54,000 across the country. This is the highest number of deaths in a single day since the outbreak of COVID-19 pandemic in the country. Meanwhile, the Indian Council of Medical Research has informed that over 19,83,000 COVID tests were conducted within 24 hours in the country. So far, over 30 crore 75 lakh tests have been conducted. Government has taken steps to ramp up availability of Amphotericin B to fight mucormycosis. A sudden increase in demand has been observed in some states for Amphotericin B, which is being actively prescribed by the physicians to patients suffering from mucormycosis, which is a post-COVID complication. Centre is therefore engaging with the manufacturers to ramp up production of the drug. The supply position is expected to improve with extra imports of this drug and increase in its production domestically. Department of Pharma had on 11th May allocated this drug amongst the states and union territories based on expected supply that will be available from 10th to 31st May. The states have been requested to put in place a mechanism for equitable distribution of supplies amongst government and private hospitals and healthcare agencies. Indian scientists have made a major breakthrough in the field of cancer diagnosis. Mumbai-based Epigeneres Biotech Private Limited and its sister concern Singapore-based SAR Labs have devised a non-invasive test which will be able to accurately prognose presence of cancer in the body even before a year the tumor cells are formed and related symptoms are visible. This technique, which is known as HRC test, will help in early diagnosis and treatment of cancer. The HRC test will also save the cancer patients from the burden of huge financial implications involved in treatment of tumor cells at a later stage. And now 20 News, here are the main points again. Today is International Nurses Day. Vice President Venkaiah Naidu and Prime Minister Narendra Modi expresses gratitude to the nurses for rendering selfless services to the people. Principal Director Health Department says state is expected to receive vaccines for 18 to 44 years within the next 1 week. Health Department asks all beneficiaries due for the second dose of vaccination to avail it at the earliest. And PM CARES fund a court sanction for procurement of 1.50 lakh units of Oxycare System developed by DRDO at a cost of over 322 crore rupees. That is all we have in this evening news bulletin. Good night.